Hello, Dr.Day and I here from Steinway Family Dental Center. We get a lot of questions about impacted teeth. So today we're going to answer some of the most common questions from you guys. And let's start with the first question. What is an impacted tooth? Well, impacted tooth is the tooth that did not grow out completely. That is when the tooth is grown, you can see it, right? So impacted means that it got stuck inside. And whether it cannot or will not come out, and it may cause some trouble with that, so it is impacted within the tissue that you have, so it's not coming out. The next question is, what causes the tooth to become impacted? Well, there are some teeth that are impacted because there is a tooth in front of them and they're not growing straight, and therefore they got stuck. Now they are impacted within the bone, right? Or they simply did not grow out on time and they're still sitting in the bone when they're supposed to be out. So that is impacted. Or the space in front of that tooth is insufficient for this tooth to come out because there are teeth that are too tight and they're not allowing the tooth to pass through. Next question is, what are the symptoms of the impacted wisdom tooth? So it is a specific tooth, right, which is a wisdom tooth, and if it is impacted, sometimes you feel absolutely nothing, you don't even know that something is in there. And sometimes you feel pressure like you have a toothache or you have an infection. And the truth is it's just your wisdom tooth causing all this trouble. The next question is, how an impacted wisdom tooth, if left untreated, how will it affect your overall health? Well, first of all, if it's not letting you sleep as it is because it is impacted and it's creating all kind of pressure and it's moving your other teeth that you want to keep, or it's drilling a hole in the tooth in front of it, then it does affect you, right? And you don't want to keep it in there because it could be from the point that you don't feel anything all the way up to you cannot stand the pain that you're getting from that. So the sooner you get rid of it, the better it is for you. The next question is, what is the difference between partially impacted wisdom tooth and fully impacted wisdom tooth? Well, full impaction means that there are tissue, either soft tissue or hard tissue, either bone or gum, all around that tooth. Sometimes the tooth already went through the bone but did not go through the gum. So in that case, it is a soft tissue impaction. But sometimes it just sits below the bone line, and that is a full bony impaction. The next question is, how do you diagnose impacted teeth, and how do you feel with severely impacted wisdom teeth? Well, first of all, you diagnose it by taking specific x-rays. It's called panoramic x-ray. It's the x-ray that goes around your head. Or it could be a three-dimensional x-ray that shows exactly and precisely where that tooth is in relationship to the rest of the teeth and other anatomical landmarks, like, for example, nerves or sinuses and so on. So that's what you do. You get an x-ray and the x-ray will show where that wisdom tooth is, or if it is impacted. If it's not impacted, you can just visually see it. So it's much more simple, right? What you don't know, if you never pull the wisdom teeth and you don't know whether you have them or not, the x-ray will show them to you and to your doctor. Next question is, what are the treatments for impacted wisdom teeth? The treatment could be from do nothing all the way to partial extraction or full extraction of the tooth. The next question, what is the process for removal of the wisdom teeth? Well, first of all, you're going to see an oral surgeon for that, and he is going to give you an injection to make you numb so you don't feel him working. And then he's going to open up and go through the soft and hard tissue to get to the tooth, and either remove it whole or section it and take it out in parts. Sometimes it's not possible to take the whole tooth out because the roots of the teeth are tangled with the nerve that gives you sensitivity on the entire side. In those cases, they do partial coronectomy, it's called. They basically remove part of the tooth that's causing the most trouble and leave the roots inside. And with that procedure, it may not bother you for the next 50 or 60 years. And by then, we don't know whether we need to remove it or not, or it will move away from the nerve and then you can still remove that. The next question is, what is the cost of removal of the impacted wisdom tooth, and does insurance cover it or not? Now, the insurance covers depending on the contract that you have with your particular insurance. We do have complimentary insurance checks, so you can contact our office and somebody here will find out what insurance you have and will get the information directly from them. Because if you call them, they'll just tell you that everything is covered and you don't have to pay anything, but in reality they don't pay a penny for that. So you want to know the real facts, you just call the office and we'll find out for you. The next question is, how much would it cost? That depends. If it is an impacted tooth, it should cost approximately about $1,000 per tooth. Next question is, what should you expect after the wisdom tooth removal? Well, I would say follow the instructions of your surgeon. If he tells you that you should hold on and off 15 minutes on, 15 minutes off ice pack, you should do that, because otherwise it is possible to be swollen after that, right? Another thing is, again, follow instructions. If they tell you not to drink from a straw, don't drink from a straw. Definitely don't smoke, because if you remove the blood clot from that extraction site, it is very, very painful. It's actually more painful if you dislodge the blood clot from there than before you even had the surgery. And it doesn't matter how much it was hurting before, this would be worse. So follow the instructions of your surgeon. The next question is, what if the impacted tooth is not a wisdom tooth but a canine? It is also common to have a canine impaction, and as you know, the canine could be on the top, could be on the bottom, and that tooth could be impacted, meaning that it's not growing straight. And usually the teeth that are impacted, they impacted because they're not facing the surface that they're supposed to come out of on the right angle, and because of that they're not coming out. Now sometimes we have canine that is impacted, and the difference is that canine does not always have to be removed like the wisdom tooth. It could be possibly brought into the alignment, into outside, and you can use that. It is a complicated procedure between the orthodontist and the surgeon, or with a regular dentist. If he uses Invisalign, he can also do that. But the question is it the best choice in your particular case? So ask your dentist. The next question is, how do horizontally impacted wisdom teeth different from others? Well, as you probably already heard in the previous answers, when the tooth is horizontally positioned, in other words, it's not vertically, but instead of growing straight up, it grows this way into the teeth in front of it. So that is different, it is common, and would that mean that we can upright it or make it go straight? Probably not, but you can get either partially extracted wisdom tooth or fully extracted, depending on the roots, how close they are to the main nerve that goes underneath it. I hope I've been able to help you with making up your mind and giving you a little bit more light on the subject of impacted wisdom teeth. However, if you have more questions, you can always call us here and come in and we can discuss it further. We can look at your x-rays, or we can take the x-rays and then look at them together, and I will answer most of your questions with that, if not all of them. So give us a call here at 718-728-3314, or find us online on alldentalneeds.com and request an appointment with me and I'll help you out.